Hi, I'm Andrea. I'm one of the pharmacists for Strive, and I'm thrilled to welcome you to another Strive Sessions. Today we're going to be talking about thyroid optimization. The FDA is currently trying to decide whether or not to allow compounding pharmacies to continue to compound with desiccated thyroid products. A number of your patients are most likely utilizing this product with great benefit, and if it is removed from our ability to compound, we want to make sure that you are ready and prepared with alternate options to help with these patients' regimens. Disclaimer: this presentation is for educational and informational purposes only and is not intended as medical advice, to diagnose, or to treat. These statements have not been evaluated by the U.S. Food and Drug Administration. Compounded medications are prepared for individual patient needs based on a valid prescription from the licensed healthcare provider. Strive's compounded medications and supplements are not reviewed or approved by the FDA to diagnose, treat, cure, or prevent any disease. The information shared is based on current literature and clinical experience. Individual patient care should always be guided by a qualified healthcare professional. While clinical data exists for FDA-approved commercial products, compounded products are not FDA-approved and have not been studied for safety or efficacy. Potential benefits apply to the specific ingredients and may not necessarily apply to a combination of those ingredients. Any experiences or outcomes mentioned do not indicate or guarantee similar outcomes for patients. Individual experiences and outcomes may vary. We will talk about compounded synthetic hormones. A disclaimer for those includes compounded medications are specially prepared for individual patients' needs only pursuant to a valid patient-specific prescription. These medications are not approved or reviewed by the U.S. Food and Drug Administration to diagnose, treat, cure, or prevent any disease. These statements have not been evaluated by the FDA. These slides are solely informational for healthcare providers and does not constitute any clinical guidance or recommendations. The listed formulations are examples of prescriptions historically ordered by licensed healthcare providers. These examples are not intended to replace or influence a provider's clinical judgment. Any suggested dosing guidance is based on clinical references and commonly prescribed protocols. It does not constitute an official clinical recommendation and is intended solely as a suggestion for healthcare providers. Providers should exercise their independent clinical judgment, expertise, and knowledge of the individual patient when prescribing compounded medications. Please assess the patient's unique circumstances, conditions, and medical history to determine the most appropriate care. Thyroid replacement history. Some of the following slides reference certain commercially available FDA-approved thyroid medications and published clinical data associated with those products. This information is provided solely for general educational purposes. These discussions are separate from and do not pertain to any compounded prescriptions. Clinical data, FDA-approved indications, and safety and efficacy findings for commercially available products do not apply to compounded medications. Treatment decisions should always be based on the independent clinical judgment of the licensed healthcare provider and the individual needs of the patient. Our agenda for today is going to include quite a few topics. We'll talk about Thyroid 101 and some of the common conditions, the FDA's stance on natural thyroid products, history and timeline of thyroid treatment. We'll speak about desiccated thyroid extract itself, as well as synthetic T4 and T3, which is levothyroxine and liothyronine. We'll talk about DTE versus synthetic, do a head-to-head comparison. We'll find out how synthetic T4, T3 can replace DTE, and some supporting products for thyroid health. All right, let's dive into Thyroid 101. Now, the thyroid itself is a small butterfly-shaped gland located in the front of the neck. It's located just below the larynx. Despite its size, it is one of the most metabolically influential organs in the body. Key hormones produced by the thyroid include T4, which is thyroxine, T3, which is triiodothyronine, as well as calcitonin. T4 is going to be the primary storage hormone, meaning the majority of that is secreted from the thyroid hormone, and it has to be converted into T3 in order to be in its most active state. T3 is in the active form, and this is what drives cellular metabolism. Now, what are some things that the thyroid controls? The thyroid can help control metabolism, the heart rate, body temperature, growth and development, mood and cognition, as well as digestion. This is why our goal is to make sure that patients are at their optimal levels of thyroid hormone at all times. So in this picture here, you'll see some effects of the thyroid hormone. We kind of already went over some of the main purposes, but you'll see that the thyroid affects the brains, the eyes, the lungs, liver, heart, the digestive system, reproductive system, and even the musculoskeletal system and the skin. There are so many areas of the body that it's important to have the most optimal amount of the thyroid hormone. Some common conditions that you do hear of include hypothyroidism. This is where you have an underactive thyroid. In this case, you'll see elevated TSH, thyroid stimulating hormone, and low free T4. Symptoms often include fatigue, weight gain, cold intolerance, depression, brain fog, and hair loss. A number of patients will come to you with these symptoms, and it's always important to check those thyroid levels to see if maybe that is the culprit of the issues. Other patients experience hyperthyroidism. So that is going to be an overactive thyroid. This is going to have low TSH levels, elevated T3 and T4. These patients are going to have rapid heartbeat. They might notice some weight loss, heat intolerance, anxiety, tremors, and insomnia. You'll see a lot of those symptoms are going to be opposite of each other. A couple other conditions that are often associated with the thyroid are going to be Hashimoto's and Graves' disease. Hashimoto's is actually an autoimmune condition that's going to present itself as hypothyroidism. In these patients, the TPO antibodies are actually elevated. These patients will have fluctuating symptoms that go between hypo and hyper phases, possibly. Graves' disease is again an autoimmune condition that can be associated with hyperthyroidism. In this, the TSH receptor antibodies stimulate excess T3 and T4. A lot of times these are the patients that we notice the bulging eyes as a hallmark symptom of. Now today we're going to focus mostly on hypothyroidism. There's a lot in this flowchart here, but basically what I wanted to highlight are there's two main types of hypothyroidism. There's primary hypothyroidism and secondary hypothyroidism. In patients with primary hypothyroidism, the problem originates in the thyroid gland itself. In this case, the thyroid fails to produce sufficient T3 and T4, so the pituitary compensates by releasing more TSH. So key lab findings in these patients are going to be a high TSH and a low free T4. This is often found in patients with Hashimoto's disease, sometimes in patients with iodine deficiency, those who have had a thyroidectomy, the surgical removal of the thyroid, or those that have had radioactive iodine treatment. Secondary hypothyroidism is a problem that originates in the pituitary gland itself, in which it fails to secrete adequate TSH. So the thyroid never receives the signal to produce hormones. These patients, you may find, have a decreased TSH and a decreased T4. Common causes of this may be a pituitary tumor, sometimes even a traumatic brain injury. So how do we treat these patients? No two patients are the same. We can treat them with synthetic thyroid products, but a lot of patients choose desiccated thyroid products or natural thyroid products. So we're going to start by talking about the history of those products themselves. This will include desiccated thyroid extract, DTE, which is actually the same thing as what we call natural desiccated thyroid, NDT. For the rest of this conversation, you will see that I am going to notate it as DTE, or desiccated thyroid extract. Now, the origins of DTE actually go back to the late 19th century in a story that begins in 1890s. At that time, a physician first recognized that the thyroid gland plays a huge role in metabolism. In 1891, Dr. George Murray in England successfully treated a patient with severe hypothyroidism by injecting sheep thyroid extract. Shortly after, it was discovered that consuming or eating thyroid hormone actually worked just as well, and this was the start of desiccated thyroid extract. Desiccated thyroid extract, being one of the first hormone replacement strategies, predates the FDA. So when it came to approval, initially it was grandfathered in. Now in 2020, the FDA issued guidance placing bulk DTE on a difficult to compound list. One reason for that is the concern about the amounts or the ratios of the product. DTE's T4 to T3 ratio is 4:1, which differs from the natural human ratio of 14:1. We'll talk about that a little bit later. But about that time, there were some brand name DTE products that came to the market. This included Armour Thyroid, MP Thyroid, WP Thyroid, and Nature Thyroid. Many of these remain commercially available and did require an NDA or a new drug application, therefore they were legal to prescribe. I want to take a moment to talk about some of the key FDA milestones when it comes to DTE therapy. We spoke just now about some of the initial therapy that was used in the 1890s, and pre-1938, desiccated thyroid was sold without any federal oversight at all. It predates modern drug regulation entirely and has been in use, again, as I stated, since the 1890s. In 1938, the Federal Food, Drug, and Cosmetic Act was passed. This brought DTE under federal oversight for the first time, but DTE retained a degree at grandfathered status. In 1941, the USP formally published monographs for desiccated thyroid, establishing the first official quality standards. It's interesting because at that time, the potency was measured by the iodine content. You'll see that that changes. In 1962, the Kefauver-Harris Amendment requires that new drugs demonstrate safety and efficacy. DTE was exempt from this. Remember, grandfathered in. In 1985, USP revises its DTE monograph to standardize by T4 and T3 hormonal content rather than the iodine alone. And this is important when we start talking about the conversion. In 1997, Levothyroxine standardization drive begins. FDA mandates NDA, or that new drug application, for T4 products. In 2012, the FDA increases oversight of compounded medications, including compounded thyroid preparations, leading to greater scrutiny about compounding DTE. From 2023 to the present, there's been ongoing regulatory debate, and that's why we're here today. The history of thyroid replacement is quite interesting. Now, I know we've talked about some of the history with the FDA and a little bit of the history with DTE, but I would really like to focus on the different products that have been utilized over time and how their popularity has changed. So we spoke about in 1891, the first DTE therapy, so that first natural thyroid therapy with the sheep thyroid extract. In 1914, T4 was isolated. So this is going to be our thyroxine from the thyroid gland. In the 1950s, Armour Thyroid came to play. This is one of our commercially available and most widely used natural thyroid products. 1958, T3 was isolated, therefore Liothyronine was synthesized. In the 1960s, we saw the Synthroid era. Synthroid gained great popularity as a synthetic levothyroxine. It was promoted as more stable, and patients continued to use it. In the 1980s, the Synthroid continued to dominate. As somebody who worked in retail therapy for quite an extended period of time, and most likely for a lot of providers that are watching today, you are most familiar with Synthroid or levothyroxine. It now has a number of different names, but an interesting thing is that DTE, or natural thyroid, made a revival in 2000. There was more of a focus on natural therapies for patients, and this again is where then the compounding pathway comes in. We were able to continue to compound with DTE and actually able to help create custom T4, T3 combinations for patients. Now the current FDA guidance and why we're here today. The FDA has made action on animal-derived thyroid products. In August 2025, the FDA issued formal notices to manufacturers, importers, and distributors of animal thyroid products. They stated that they were going to take regulatory actions about decreasing or discontinuing the use of these products. The FDA is making a decision to make these animal-derived thyroid products considered biologic products. And as a compounding pharmacy, they become ineligible for traditional compounding pathways. So unfortunately, that would potentially remove our ability to compound with the natural thyroid. The reasons for this, or concerns related, is that there's batch-to-batch potency variability. There's inconsistent thyroid hormone content, that was the T4-T3 combination, manufacturing quality concerns, impurity risk, and just a lack of an FDA-reviewed safety, efficacy, purity, and potency data. So current FDA messaging is that there will be an answer given to us, hopefully by August of 2026, so very soon, that will either determine whether compounding pharmacies or whether this product in general can continue to be given to patients. Now let's talk about the thyroid regimens themselves. So what is DTE? DTE is desiccated or dried thyroid extract, most oftentimes derived from the thyroid of glands of pigs or porcine. DTE will contain a full spectrum of thyroid hormones. This includes T4, T3, bits of T2, T1, and calcitonin. So this is going to be a full natural ratio of the thyroid hormone itself. Now when we're talking about the amounts in the DTE, we consider it per grain. 1 grain of DTE is going to be 60 milligrams. Now what they've found is that contains basically 39 micrograms of T4 and 9 micrograms of T3 with trace elements of T2, T1, and the calcitonin. So when we talk about this, the ratio is closer to 4.2 of T4 to 1 of T3 versus the human ratio of 14 to 1. Now with that, it means it has a bit higher of a T3 load. This is sometimes what causes some side effects in patients. They may notice some palpitations, nervousness, a bit of insomnia. So that is something to keep in mind when prescribing these products to patients. Now we speak about synthetic T4, or levothyroxine. So levothyroxine acts as a synthetic form of the endogenous thyroid hormone thyroxine, T4. So this helps to replace deficient hormone levels in patients with hypothyroidism. Following the administration of levothyroxine, the T4 is peripherally converted to T3. This is its most biologically active form. This is where it binds to thyroid receptors to regulate gene expression that's involved with metabolic rate, protein synthesis, thermogenesis, and even energy metabolism. Many patients are initially put on a T4 regimen. But it is important to understand that about 15% of hypothyroid patients on T4 alone continue to report that they have fatigue or cognitive symptoms despite some of the normal levels. One of these reasons could be that they are not great converters of T4 to T3. Key pharmacology with levothyroxine includes its half-life, so it's fairly long. This allows for daily dosing. Something to remember with thyroid products is they should most often be administered in the morning away from food. The onset to steady state is a bit longer, 3 to 5 weeks, and it does require monitoring after a patient begins at about the 6 to 8 week mark. You're going to notice that side effects are going to be similar for all thyroid products, but most side effects with the levothyroxine patient are going to be a bit more manageable than those who are utilizing a T3 product, which we'll focus on next. Synthetic T3 is liothyronine. So liothyronine, as I stated, is the synthetic form of T3, which is the most biologically active thyroid hormone. So unlike T4 that has to be converted, T3 is already in its most active form, meaning it will directly work on those hormone receptors. There are many patients who can benefit from T3 therapy. These are either going to be patients who have persistent symptoms despite being optimized on T4 therapy. These are patients who cannot convert T4 to T3 very well. Maybe some of those patients who are post-thyroidectomy or patients who are transitioning off of DTE who want to continue to have some T3 activity. Now this product really has a very short half-life. So because of that, it oftentimes needs to be given more than 1 time a day. The body will metabolize it very quickly, therefore it has to be given more often. One thing that a compounding pharmacy can offer is a modified release form of the T3. This we call E4M. This is designed to release the medication steadily throughout the day. So as we move forward, we have to realize there's no one single approach that's universally best. Whether a patient is not able to convert the synthetic products very well, whether they have a preference for the more natural product, every patient is different. So with this, it's important to understand what each one is. So here we compare DTE, synthetic T4 alone, and then also our synthetic T4-T3 combination. One of the benefits of the compounding pharmacy is that we're able to actually combine T4 and T3 together so patients can maintain both benefits. Now, we've talked about the majority of these categories before, but the one I want to focus on real quick is the bioavailability, and one of the reasons why the FDA is considering changing these to a biologic product and not allowing compounding pharmacies to utilize it. With the desiccated thyroid product, the variability of the bioavailability is different batch to batch. So that's something important to remember when you're treating patients that are utilizing the natural thyroid product. Whereas with synthetic products, it's going to be more highly standardized. Now, as I switch to this next slide, it's going to be probably one of the most important, but also can be quite confusing. So I'm going to take some time to break it down for you. Now, when DTE is unavailable, contraindicated, not tolerated, a commercial or a compounded T4-T3 combination can help replace it. So in this case, if this natural thyroid is taken away from us as a compounding pharmacy, I want to arm you with the knowledge to be able to convert your patient to an alternate regimen. The best case scenario would be to convert your patient to a T4-T3 combination. Now you'll see here, if we look at this 65 milligrams, which is equivalent to 1 grain of our nature thyroid, that's going to be most equivalent to 100 micrograms of levothyroxine itself, the synthetic form, or 38 micrograms to 9 micrograms of the T4-T3 combination. Now, why 38 to 9? That doesn't make sense. That doesn't add up to 100. But you must remember that the body is going to convert this 38 micrograms of T4 into its most active form of T3, which is included as well. So step-by-step transition suggestions would be to calculate the T4-T3 equivalency using the patient's current natural thyroid dose. Here you can see we have a number of them listed. Prescribe the compounded T4-T3 capsule, and then recheck levels in about 6 to 8 weeks and titrate as needed. It's always important to monitor symptoms such as energy, cognition, patient's weight, and heart rate. With a compounded T4-T3 regimen, you might find that patients need to use it twice daily, or as I stated before, we can compound it as E4M or a modified release that's going to help maintain those T3 levels fairly stably throughout the day. Low-dose naltrexone. Why is this in our thyroid optimization deck? Well, it's becoming a novel approach to thyroid immune support. Low-dose naltrexone transiently blocks, so very quickly blocks the opioid receptors, prompting the immune system to recalibrate. So this is going to help limit the immune attack on the thyroid tissues that's seen in some of those autoimmune conditions. Low-dose naltrexone also helps to address inflammation. It'll help to address inflammation related to activity within the thyroid tissue. A lot of patients on LDN have reported changes in their symptoms, so healthy changes. Now, low-dose naltrexone is started low and is increased slowly over time, most oftentimes with an optimal dose about 4.5 milligrams a day. So we start at 1.5 milligrams for a week or two, increase to 3, and then on to 4.5 milligrams nightly. This can be given along with the rest of the thyroid regimen to help support the patient. There are potential side effects with low-dose naltrexone, the biggest being vivid dreams. Now that is something that will dissipate over time. As we continue on, we are going to talk about some supporting products or supplements that can be utilized in the thyroid regimen. Dietary supplements are not reviewed or approved by the FDA. These statements have not been evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease. On to the supporting players. There's really 3 that I'm going to focus on. The first being iodine. So the thyroid requires iodine to produce T3 and T4 hormones. Deficiency in iodine is going to be the leading cause of hypothyroidism globally. Now, do understand an excess in iodine can actually worsen thyroid conditions, so the supplementation does need to be regimented. Next, let's speak on selenium. So selenium is going to support the conversion of T4, our inactive form, to T3, the active hormone. It also has antioxidant properties that help protect the thyroid tissue. And last but not least is zinc. So zinc is involved in thyroid hormone synthesis and metabolism. Deficiency can impair thyroid function and conversion of T4 to T3. You'll notice there's a lot of other supporting products, vitamin D3, magnesium glycinate, ashwagandha, iron or ferritin, B12 and folate, and omega-3. All of these are going to help support your patient through their thyroid journey. Don't settle, strive. So at Strive, we believe every thyroid patient deserves more than a one-size-fits-all prescription. No two patients are the same, and no two patients' thyroid story is the same. So whether a patient is needing a compounded T4, T3, custom ratios, modified release formulations, allergen-free bases, nutrient protocols, that includes those supplements. And as pharmacists, we have the opportunity to work directly with our providers to help determine the best thyroid regimen for your patient. Please see the references used for this deck, and you're more than welcome to utilize them for your own education. It was so wonderful to have you join me today. Thank you for spending some time with me learning about thyroid optimization. Please stick around for a live Q&A.